How should I express discontent? Patients tend to show irregular or abnormal behaviors when they are affected by their symptoms, like hallucinations or delusions. Moreover, patients often find it hard to control their emotions, leading to conflicts between family members and caretakers. Some extreme cases might even involve violence. These situations may affect relationships in the family, such as feeling very frustrated towards the patient or even criticizing or alienating the patient. Family members may tend to chastise the patient, thinking that the patient isn't fulfilling their expectations, thus wanting to force the patient to change. And maybe family members might use a negative attitude to judge the patient, thinking that the patient is the root of the problem. Research has found out that the chance of relapse of a patient is positively correlated with the number of conflicts in the family, meaning that the more conflicts in the family, the larger the chance of the patient relapsing. On the other hand, if family members can strive to be compassionate and understanding towards the patient, it will be helpful towards the recovery of the patient. As family members or caretakers, we should try to understand that mental conditions and medications do have certain effects on the patient, and therefore we need to be accepting and compassionate towards the patient. But if there are situations in which something unreasonable happens, we should also give suitable criticism. Suitable criticism helps us to empathize with the patient and understand the situation more, and it also reminds others to be more disciplined. Criticism should be simple, clear, and serious. At the same time, we should remember to respect our family members and try to comment on the situation, but not the person. While we are considering giving criticisms, we can consider the following techniques. Explaining why the certain behavior is inappropriate. Letting patients or family members know the reason behind this helps them understand why the behavior is inappropriate. Expressing feelings and emotions. This is relatively difficult for a lot of people, but it is crucial to express one's feelings to let the patient empathize and understand your viewpoint. Showing trust and support. This can support and encourage the patient to improve. Suggesting reasonable expectations. This can help the patient know what is expected of him or her and have a clear direction of what to improve on. For example, you came back really late last night and it might not be safe. I hope you understand that this made me very worried. If you are going to be late next time, would you mind giving me a call beforehand? Sometimes, when we are really angry and frustrated, it is very hard for us to control our emotions. We can consider expressing our emotions, then leaving the room for a while to allow for us and the patient to calm our emotions before dealing with the situation in a mature and calm way. For example, I am really angry and disappointed right now. I need a little time and space. Hopefully, when I come back, I will be able to deal with this in a calm and mature way.